Hey everyone, it's Dr. Mache, and I'm excited to be with you on Ask Dr. Mache. We are here on Facebook Live. It's the first Thursday of the month, and I'm really excited to be here. It's been a little bit of time since the last Facebook Live. We've had a lot of traveling, a lot of different meetings I've been speaking at. Just back from Houston, where I spoke at Baylor College of Medicine, and prior to that, some other places around the country. And in December, I'll be talking about at the Massachusetts Conference for Women. And actually, I'll be talking there about how menopause affects work. If that's a topic you're interested in, let me know. We can talk about that. This is brought to you each month by Hot Years magazine. And the Hot Years is a magazine that you can get online. And it's available to you at hotyearsmag.com. It's a free publication. It's digital. It's the #1 digital magazine for women in midlife. And just go there and subscribe. It's free, and you'll get one of the most effective ways of keeping up with issues and changes in menopause available on the web. And it's available for your computer if you want to just watch it from your laptop or your iPhone or your Android, whatever you like. You'll find it very useful, easy to read, and informative. As we say on the top of the cover, we add insight, inspiration, and information. Well, I'm going to talk to you right now about perimenopause. Perimenopause is that window around menopause. And I'm finding it's an increasingly important topic because it's so confusing to women because they don't know what's happening. A lot of people think that menopause is something that happens when you are older. And by older, I don't mean really old, but older than someone in her 30s or 40s. Someone who's in her 50s might be going into menopause, but in fact, about 5 to 10% of women go into menopause before age 45, and the symptoms of menopause, which are called perimenopause, that window leading up to menopause, start up to 10 years before that. And you may know those symptoms. Are you a woman who is dealing with certain warmth and hot flashes? Are you finding that you're moody? Are you finding that your brain is a little bit foggy? Maybe you're someone who is now having trouble remembering what she went to the grocery store for. Maybe you walk around the parking lot with your clicker trying to find out where you parked your car. As one lady told me, she was called by her family to stop and get some dog food on the way home from work. She not only forgot to get the dog food, she forgot to pick up the kids. So you can see how it can be a very, very challenging time. And then there are much more personal kinds of things that happen, things to do with intimacy, changes in libido, changes in bladder sensitivity that cause you to stop along the way and know where every bathroom is between your house and just about every place that you go. And so it can be a really challenging time. And those are kind of the more obvious or the noisy kinds of symptoms, but there are also silent symptoms that can be going on too. Changes in bones and bone health, changes in your heart and your arteries, thickening of the arteries, and so forth. So what are you to do? How would you know you're in menopause or perimenopause? What would be the kinds of ideas you might have? You know, if you're a woman who is 35 or 40, you're probably not thinking about menopause. You're probably not thinking about perimenopause. But I can tell you that I, as a menopause expert, and I see patients at Beth Israel Hospital, Harvard Medical School, where I in the beginning of my career, I actually did some of the first in vitro fertilizations in the country, and actually even help gorillas get pregnant at the zoo. But more recently, in the last decade or more, decade and a half, I've been involved in the menopause arena because when my wife had surgery that threw her into early menopause, shortly after a study came out in 2002 suggesting that estrogen caused breast cancer, it was wrong information. But a lot of people believed it and continue to worry about it today. And as a result, I switched from my fertility career to menopause to help her figure it out, because otherwise she was just going to have to tough it out. And you may be toughing it out too, because you're kind of unclear what you should be doing or not doing. Well, what happens in perimenopause that makes it so symptomatic? Why are those symptoms so challenging? What goes on? And by the way, if you have friends who might benefit from this, please let them know and they can listen in. Also, if you have questions, just chime in. I'll be happy to try to answer your questions, and I look forward to the opportunity to address them, because I know sometimes it's pretty hard to get information for questions that you have. How do you get that information? So what happens? Well, you might remember when you were a young girl and you were going through puberty, how crazy you felt. You noticed that your periods got a little bit irregular. They were different than they started to have staining or spotting, and that was unusual and a little bit awkward. You might have noticed that your skin was having changes, your hair was having changes, your mood was having changes, you were more interested in boys all of a sudden. There were a lot of things going on that somehow you didn't exactly know what it was, but it was really different than it was 6 or 8 or 12 months ago, or a year or 2 years ago. It's just very different. Well, when you go through that window of time, you're actually going through a time when hormone levels, mostly estrogen and progesterone, are very low. And then suddenly those two hormones start to awaken and start to get higher. Sometimes one's higher than the other. That's what causes the mood changes, what causes the skin changes, what causes the period changes, etc. And then you go through a window of about 30 years or so where you're really pretty constant. Your periods are much more regular, your mood's much more regular. You can get pregnant more easily. And then suddenly what happens is you start to go through this window of transition, of change. And when that happens, then the hormones start to get unbalanced again. And so after 30 years or 35 years of having pretty constant sort of hormonal input to your body and your brain, so that your body, mind, and spirit are feeling pretty constant, all of a sudden you start to have those same experiences that you had when you were younger. You start to have changes in your periods, changes in your sleep, changes in your mood, changes in your bladder, changes in your skin, changes in your body parts, changes in your memory. All of these things are very, very normal and incredibly disruptive. But the thing is that if you are dealing with those imbalances, it's possible to get hormones that can help you balance them back. When you first start going into perimenopause, people think everything to do with that is a lack of estrogen. But it isn't. It has to do with two hormones, estrogen and progesterone. And what happens is that during the time of perimenopause, what happens is that the ovaries are trying to produce an egg. Because after all, we're all on Earth to reproduce. That's the purpose of people. That's their biologic purpose. And then what happens is the hormone imbalance prevents one egg from coming forward. And lots of eggs come forward. Maybe a dozen or 24 eggs come forward. And the sum of all of that egg production is a very high estrogen level, even higher than when you were more regular. But none of those eggs get mature enough to actually finish the job and then release into the egg into the body so that it can get pregnant. So you don't get progesterone, and progesterone means progestation, and it's what happens when the egg ovulates. Estrogen is formed as the egg develops. The ovulation release of the egg happens, and when the blood comes into the follicle, the little fluid-filled sac that surrounds the egg, right after ovulation, it goes right into the little opening where the egg came out, then suddenly progesterone is starting to be made. Well, that never happens in perimenopause, or seldom happens. So there's lots of estrogen and very little progesterone. So the moodiness and so forth initially is from not enough progesterone. But over time, then what happens is estrogen and progesterone come down to very low levels, and then the differences that you feel and experience are due to a lowering of both hormones. So this is basically what happens in perimenopause. And then finally, if a year goes by and there's no period, that's menopause. That's the definition. Other symptoms that can be associated with perimenopause that you may not hear about but are common are palpitations. You feel your heart just fluttering. Hair growth. You may notice hair on your chin or your eyebrows start to get that connection between them, and it requires a lot more plucking and so forth. And that's because in that window of time, the androgens, the so-called, the quote, male hormones, that's because there really aren't male or female hormones. Men have estrogen and women have testosterone. But what happens is men typically have much higher levels of testosterone and women have much higher levels of estrogen. But in perimenopause, the androgens, or testosterone, and other androgens like androstenedione, those kinds of hormones are produced, and they cause these facial hair. They may cause a little bit of hair on the breast or the chest, a little bit of more in the pubic area, and all of these things are pretty common in women. And they can be pretty annoying for people, plus all the things that I talked about. And I discuss all these in my book. It's a best-selling book. It's called The Estrogen Fix. And if you haven't got this book and you're a woman who's in perimenopause or menopause and you want to understand how hormones are affecting your body, not only, some of the bigger questions, but how does it affect your brain? How does it affect your breast? How does it affect your bladder? How does it affect your bones? How does it affect your vagina, your skin, your bladder? All of those things are being affected by the hormonal changes that happen very naturally in perimenopause and ultimately in menopause. And in the Estrogen Fix, you get information that tells you which hormones to take, how they're different, what's the difference between bioidentical hormones and other hormones like conjugated hormones, what levels they're in, and so forth. And the many routes. Should you take them on the skin? Should you take them as a spray or a gel if you want them on the skin? Should you use them through the vagina? Do you want to use it as an estrogen, as a ring, or as a pill in the vagina, or as a cream, or any of a suppository, or all of the other kinds of questions that come up, and there are many. And there's a lot of data on how come it's safe and how come I'm so confident to tell you that when you've heard rumors that that's not the case. Once again, if you have any questions, you're welcome to put them in. And please tell people about this Facebook Live if they're interested in this topic. This is a good way to get questions answered. I will post this on my YouTube channel, Dr. Seibel, DoctorSeibel. It'll be there in the next day or so, and I will also, of course, post it on Facebook on my Menopause magazine, The Hot Years. And if you go there at My Menopause Magazine. You'll find it posted. Well, you're here now. You know where it is. And I will continue to look for questions that you might have. So if something comes to your mind and you want to ask about it, then put your question down, even if it's not now, because there's an opportunity that I can address your question at a later date, tomorrow or the next day after that. I generally don't look too often, but if you do put it in, I will be looking to see if there's anything I can do to help you. I really do want to help people, just like I wanted to help my wife when she had to figure things out, and I feel very committed to the women that I take care of, because I feel that good information is very hard to get today because there's so much confusion surrounding hormones that people aren't certain who to believe or what's the facts and so forth, because hormones got such a bad rap that compared to 2002, there's 80% fewer women on hormones today than in 2002, although the reasons are mostly completely based on fear and misunderstanding. And of course, the numbers of doctors that are aware of how to talk about hormones and menopause is also reduced because there's been less women for them to treat through the years of their training and beyond, and so they don't have the experience with it. So that's a real issue for women. And of course, all of those changes I described, you can imagine, could have an impact on women's quality of life, on their relationships with their kids, with their partners, and also their relationship in the workplace. And on another occasion, I will be talking about that because, as I mentioned, I'll be speaking on December the 5th at the Massachusetts Conference for Women here in Boston. I'm pretty excited about that talk because there will be about 5,000 women there, and we'll have a chance to really get into a discussion with women who are actually experiencing this and get a first-hand discussion of the many things that can be done to make life better at work, improve quality of work, and improve attendance at work, and lower the number of doctor's visits at this time of life. And there's a lot I have to say about that, which we could talk about on another occasion. I have a question I'd like to ask you, and that is, I am about to revitalize a coaching program that I have developed. It's one that would last for 6 weeks, and it has modules that talk about the emotional changes that happen with perimenopause and menopause, the physical changes that happen, the lifestyle changes that you have to do in order to improve the quality of your life, changes for your sleep, changes for your stress, lowering your stress, changes with your diet. What should you really be eating? What foods would be most helpful? Which are not helpful? I did a talk at Harvard Medical School just about a month ago on nutrition and menopause. There's a lot of data on that. And then issues related to weight control. And then hormones, which ones, how much, how long, that kind of thing. And then thriving beyond menopause. The things that you can do to improve sexuality, to be aware of diabetes, what you can do about it, hot flashes, and so forth. So it's a very comprehensive course with printouts, with videos that you can watch at any time. And then there's specific live coaching calls that come with me doing it, asking questions, answering your questions that you have on a weekly or every other weekly basis. So if that's something of interest to you, I'd love to know about it, and I can get more information to you. And I remind you again that this is brought to you by Hot Years, the Hot Years magazine, which is available to all of you at no cost at hotyearsmag.com. And I hope you'll go there and take advantage of this wonderful award-winning magazine, because it has tons of stuff that will help you. if you have any questions, I hope you'll address them to me. I wanted to talk a little bit about perimenopause, and I hope that if you do have questions and you don't see this, you weren't able to attend when it's live, that you or your friends will ask them over the next few days, and I'll be happy to get back to you. Well, that's what I wanted to say about perimenopause. If I have questions on other topics, I'd be happy to address those. But I hope that all of you got out and voted at the recent election. It was enormous turnout, and people were definitely out there in the vote. I went with my 94-year-old mother to the polls for her to vote, and that, of course, was quite an experience for her and for me to go through it with her. And so that was awesome. Hi, Maureen. How are you? Thanks for saying hello. Have you got a question or something I can help you with? I'd be happy to try and do that. Where are you calling from? Where are you watching this from? And so it's been an exciting, a really exciting time. Also, if you're having issues that you wonder, could it be perimenopause? Well, let me know. We can talk about it. Because a lot of people go to one doctor or another. One of the things I notice the most commonly when women are in this transition is they go from one doctor for their heart, one doctor for their mood, one doctor for their vaginal dryness, and so forth. And they're just confused, and then finally somebody tells them they're perimenopause. So you are in Cleveland. Oh, well, welcome here. I don't know if you're just joining or you've been listening for a while, but we have been talking about perimenopause in great detail and going through the many symptoms and why it happens. If you have a particular question, I'd be happy to address it for you. But there's just a lot going on right now in the country, and women in menopause and perimenopause in particular. And there's so many things that are distressing because at some point, if we could talk about it also to do with perimenopause, has to do with if you've finished having kids or not. Because if you're a woman who's in her 30s and you haven't finished having your family and you find out, oh my God, I'm in perimenopause, what can you do about that? And there's a lot you can do about that. The first thing is to sort it out as quickly as you can. And if you're single, it may be possible for you to freeze eggs so that you can have them at the most safest time you can. And if you are in a relationship, you can fertilize your eggs and freeze them for a later date if you're not going to have kids at this moment. But fertility issues have to be taken into account on the one hand, and on the other hand, you have to take into account the issues related to your general health. Let's see. You're saying you've been listening to the video every time. I am 56 with no children. Well, I don't know if you were planning to have children or you weren't planning to have children. Some women don't plan to have children, and others, it just doesn't work out for them. Or they might not have a partner or someone that they could have a child with. And so the time in life when it generally happens, for most people, just doesn't occur for them. And that may be a very big emotional issue for them, or it may not be. It may be something that was their decision and they wanted to have a life that they devoted more to their relationships or to their careers or whatever it was they wanted to do, and having kids just didn't fall in. So let's see. It says, no plans to. Well, you know, as I said, some people have kids and some people don't. and both are good. It's just a matter of what works for you. The reason I mentioned, though, the issue of children is just that while some people are worried about going into menopause, from perimenopause, some people are worried about going out of their fertile times. And the thing that's most important is how do you view yourself, because menopause is really not about age. As I've mentioned, some people go into menopause before 40 and perimenopause well before. It's really not about age. It's about transition. And so it's not something that you should be thinking about as I'm getting older. It's just that you're transitioning from one time of life into another time of life, and that's really what it's about. And understanding what to expect, and then trying to anticipate that, and then taking care of yourself so that you maintain the fewest symptoms, and also try to prevent some of the things that can happen. Like perimenopause is a time of rapid bone loss, so that's a good time to be taking calcium and to check your vitamin D level and to exercise to keep your bones strong. These are things that you can do and that everyone can do and should be doing. It's also a time when, depending on whether or not you take hormones or not, where plaque can be going into your heart, and you could be having hardening of the arteries at this point. So having a baseline check for your heart is a good idea. Certainly at 50, it's a good time to get a bone density. That's a very low radiation test, and it's one that can tell if you're losing your bones at a faster rate, your calcium out of your bones, if you're thinning at a faster rate than would be typical. So all of these things are part of your plan to try and make sure that you're protecting yourself and your health as you get older, so that you're going to be in the best possible health that you can, and not only live longer, but make it feel like you're living a time when you're enjoying the quality of your life and not in a situation where the quality of your life is reduced. It doesn't have to happen. What we want to do is live a strong, healthy, vibrant life, and for all the years we get. And that starts by having habits when we're younger that we keep doing a little bit every day. Eat healthy foods, exercise, don't smoke, get enough sleep, lower your stress. These are things that serve you well whether or not you take hormones. Well, I want to thank you for saying hello, Maureen, because I'm always happy to talk to people or to get to know people in different parts of the country or different parts of the world. Sometimes we have people that join from other countries, and so it's always great to have you, and thank you for being brave enough to speak up and say hello. I'm generally here on the first Thursday of every month, but sometimes I put in extra Facebook Lives when there's something particular that comes up at a different time. They're generally at 9 o'clock Eastern on the first Thursday of the month, and I hope you'll share these with your friends. I hope you'll join me on the next Ask Dr. Mache. It'll be definitely the first Thursday of next month, but possibly even before then. If you have topics of interest to you, I would love to know about it. I remind you that you can get your issues of the Hot Years at hotyearsmag.com. And if you are a person who is thinking in any way about hormones and you want to have a really good conversation with your doctor so that he or she knows that you're informed and you want to know what's best for you, then I would recommend strongly that you get the Estrogen Fix. It's in bookstores everywhere. It's in Amazon, and it's been suggested and recommended by the North American Menopause Society, not only for patients, for women who are going through perimenopause and menopause, but also for their doctors, because there's so many good references in it so that people can see exactly the science behind what I suggest is the facts, which will help you a lot in this journey. Well, I want to thank you again for joining me. I look forward to seeing you the next time on Facebook Live. In the meantime, stay well.